Hi, awesome disease and public health students. I'm going to use these slides to go through cardiovascular disease and heart disease, the number one killer globally. So they first talk about valve abnormalities, and hopefully you remember this from biology, but valves are like the doorways in the heart. We have four of them. You have the atrioventricular valves right here, which are between the atrium and the ventricle. Remember, the atrium is where blood comes into the heart. And so these valves separate where the blood comes in from the ventricles, which is where the blood goes out. And so blood passes through these right here to go into the ventricles. And then you also have semilunar valve, second set right there. The purpose of valves is to ensure efficient blood flow, right? Good pumping allows pressure to build up inside the ventricles here. And it prevents blood from flowing backwards. So they list a number of different issues, but the one I want you to make sure you're familiar with is what's called mitral valve prolapse, which is a fancy way of saying that the mitral valve right here doesn't close properly, this one. And so what happens then is that there's not quite enough pressure in the left ventricle to pump blood efficiently through the aorta into all parts of the body. And also some blood actually flows backwards into the atrium. So it's a loss of pressure and not very efficient circulation. And so it can be fixed surgically. Heart failure is kind of a general term, but it just means the heart cannot adequately pump blood to properly provide oxygen to all parts of the body. So it's not a good situation. Common symptom is the enlargement of the heart, just because it's swelling up with blood and trying to get the blood pumping. And there's people often get kind of swollen ankles, right? The blood is starting to pool because they're losing pressure. There's a variety of different drugs that are used to treat this, and cardio inhibitory if the blood is working too hard, or cardiostimulatory just to get the heart pumping a little bit more. The most common cause is coronary artery disease, which we'll talk more about, but that's plaque buildup inside an artery, so it's just harder to get the blood through. But there's also cardiomyopathy, which is just an infection that just weakens heart muscle. So there's various artery diseases. Remember, arteries are kind of the highways that blood travels through to the lungs or to the body, so blood is exiting, going away from the heart. An aneurysm is when the wall weakens, and so you get this sort of swelling, and it's dangerous because it could potentially rupture, and then that's a lot of blood loss and needs to be fixed surgically. But as we mentioned, coronary artery disease is kind of the really big one. This is plaque buildup, which is plaque comes from cholesterol, sort of a low density lipoprotein. That's what LDL stands for. That's kind of like the bad cholesterol that you hear about. It builds up on the inside of the artery and can block it. And again, it causes what's called atherosclerosis, where when it hardens the artery, and that's not good because the artery does need to swell and shrink as blood moves through it, and so that's going to increase blood pressure. So it's a little confusing with the terminology, but bear with me here. So here's how this all connects, right? Heart failure due to coronary artery disease, right? So once plaque has blocked up to 50% or more of the artery, what that then causes is whenever a person's exercising or in a stressful situation, even if they're like going on a long walk or something, they're going to feel chest pain. And that chest pain is called angina pectoris. And it's basically a sign that blood is not being adequately pumped around the body. Ischemia is a common symptom of that, right? It's a lack of blood flow to the heart muscles in particular, right? So it's important to understand that this is blood getting to the heart muscle, providing oxygen to the heart muscles, and it's weakening the heart. So there are what are called classic angina symptoms, which is experienced mostly by men. This is what we associate a lot with heart attacks as well, because this is basically the beginning of a heart attack. But you hear about the left arm pain, nausea, and just shortness of breath and fainting. What's interesting is that it's not the same in women. It was believed for a long time that women just don't have heart attacks. Turns out that's not true. They just have different symptoms. They have what's called angina equivalent symptoms, which is unusual levels of fatigue, often flu-like symptoms. But what's weird is that they really have no pain. They don't get that chest pain or left arm pain that is usually felt by males. So here's an image from your book that is a good sort of showing the buildup of the plaque right there. Again, it could be fats, it could be calcium, but usually it's cholesterol, the LDL, the bad cholesterol. And again, once more than 50% has been blocked, then you're at high risk of then getting a full blockage there if something large that's moving through your blood can't get through. And that is what causes a heart attack. It's called a myocardial infarction, but that's when an artery feeding the heart muscle is completely blocked, and that means the muscle is dying, which is not good because that's the muscle that is causing your heart to beat. And so it can be treated if it's all about timing, right? If you can get to the hospital really, really fast, they have amazing ways of treating this. They'll give you a blood thinner immediately. They do what's called a stent, where they literally send a little tiny wire straight up through the artery, and then they have a little balloon that they can inflate on the end of it that will kind of stretch out the artery and often break open that little blockage there. It's pretty incredible when you think about it. Other forms of cardiovascular disease you hear a lot about are hypertension. That's just really high blood pressure. They call this the silent killer because a lot of people don't even realize they have high blood pressure. It's something you just kind of have to test and make sure it doesn't run in your family. PVD, which is peripheral vascular disease, is narrowing of the arteries in the legs, often results in a lot of pain in muscles and things like that. And stroke, which is kind of a scary one, which is a blockage in the brain. You can see this image up here. And again, it's often due to this plaque buildup, that if something gets dislodged and then gets stuck in one of these kind of much finer arteries or capillaries up in the brain. There are two versions of it. You can have what's called ischemic, which is just an artery that feeds part of the brain becomes blocked. It's often transient, but can be very severe. But that's just a blockage. Hemorrhagic is the bad one. That's where the artery actually bursts inside the brain, and so bleeding can occur, and that usually requires surgery to fix. So, how do you avoid these things? Again, I know that your age demographic, you're not quite in the danger zone for a lot of this yet, but I think one of the resounding things I see is to stay active, right? One of the common symptoms is just lack of physical exercise. Do not smoke. And vaping is also getting onto this list. And some people aren't even sure what the connection is between smoking and these heart conditions, but there is a correlation for sure. Making healthy food choices, in particular, fatty foods are healthy. You don't want to just cut fat out of your diet. You need fat. But in particular, you want to avoid overly fatty foods, and you want to avoid, again, what's called LDL cholesterol. That's the really bad stuff. And unfortunately, that's what's in a lot of our food. So keep that in mind. I hope that was helpful. Thanks.